We live in times of social distancing. We work from home, we stay at home, and we try to stay healthy. During these times, telehealth is a key technology as it provides immediate assistance and monitoring of remote patients. As telehealth could ease the pressure on hospitals, governments all around the globe strengthen existing telehealth programs and reduce the restrictions on such services. Will we therefore see a rise of telehealth in the aftermath of the crisis? My guest today in this responsible innovation story is Malcolm Fisk. He's a renowned expert in the field of telehealth and digital health. Malcolm Fisk is a research fellow at the Center for Computing and Social Responsibility at Domofor University in Leicester. He's member of the International Society for Telemedicine and eHealth. He serves as an expert advisor to national and international bodies such as the World Health Organization. He also leads a European Commission funded project called Progressive that addresses standards in the field of active health and healthy aging. And he also supports other European funded projects in the area of responsible research and innovation, such as the Living Innovation Project. Malcolm, before we go into the details of your research, let me ask you a few personal questions. You're living in the United Kingdom. How is the situation in your country?
Well, we're in April 2020, of course, now, and at the early stages of the coronavirus pandemic. We don't know quite how the situation is going to unfold with the number of people contracting the virus and the number of deaths that will result. By the time this video goes out, we may have greater clarity, but we may also be at the peak or following the peak of the number of deaths and infections. So there's an air of uncertainty around the UK at the moment. People are, of course, subject to different restrictions that have been imposed on them with regard to their movement and their work. And this, of course, is having an impact on people as well in terms of their income and their social, their family lives, as well as their economic situation. So a lot of uncertainty. And I think we have to wait a few months to see how things will unfold.
You're an expert on telehealth. In times of social distancing, this seems to be a promising alternative. What are the benefits of telehealth for patients on the one hand and for medical personnel?
From the point of view of the people who provide different kinds of healthcare services, there is the potential for saving costs and having greater efficiencies in their practices and in their work. From the point of view of people or patients, there is clearly the convenience of being able to contact medical practitioners, doctors, consultants, and so forth online or via the telephone, which can clearly avoid much traveling, and clearly there's a special benefit for people who are in remote and rural areas.
Could you give me a few examples, let's say good practice examples in the field of telehealth? How does telehealth look like for the patient?
The first one would be a particular service that operates in the north of England, and it's operated by the Airedale NHS Foundation Trust. So it cuts across health and social care. It actually offers online telephone and video consultations to a wide range of people, whether they are in their homes or whether they are in institutions. It even actually extends the service to people who are in prisons. So at the bottom end, you've got the ordinary telephone, which is a familiar piece of technology to almost everybody. Now, and at the other end, there's a vast array of technologies that can help, including body-worn devices, worn on the wrist particularly, which can monitor your pulse, your heart rate, your respiration and things like this. And so it can be a useful aid both to clinicians if you choose to share your data with them, or it can be a useful aid to yourself in order to monitor your well-being, your health, your fitness, and so forth.
What are the most important challenges, technological challenges, but also challenges of responsibility and societal concerns about telehealth?
The technological challenges we've just started to touch on, haven't we, with regard to data? And clearly some clinicians are a little bit ambivalent about the whole topic of data because they, like all of us, I suppose, are going to be inundated with information. A lot of it, which is routine and tells us very, very little. On the other hand, we have got the challenges around artificial intelligence. We've got challenges around the use of genomics and so forth. And therefore, we need to put in place frameworks, ethical frameworks, if you like, in order to ensure that the data that's gathered by those means is going to be used responsibly, and where a very high element of control is vested in the patient, in the people, in you and I, rather than with our clinicians and doctors. One of those big challenges that need to be addressed, and that is to make sure that as we adopt, or as patients and people demand that these things are adopted, telehealth practices are adopted, that we have a workforce that actually understands what it's all about, actually has got the skills and the competences to engage with people in new kinds of ways. And even though many people in this COVID-19 crisis are going to be developing such skills very, very quickly, I'm afraid to say that the training institutions, the universities, and the societies for the different professions are a bit behind the curve here.
You are preparing currently a scientific paper on telehealth in the context of COVID-19, in which you compare the perspectives of Australia, UK, and the United States.
Yes.
What were the most important differences? How are these countries implemented measures to contain the spread? What kind of technologies did they use? And what are the main findings when you compare these three countries regarding their fight against COVID-19?
So what we looked at specifically was how telehealth might be used to help in the process of diagnosis, and also then the ongoing monitoring and treatment of people with COVID-19 infection in their home rather than in institutions. And what we found in the three countries were that all three did actually put into place quite urgently some measures that would enable telehealth services where they existed to be expanded to a wider range of people, including those who may have or be suspected of having a COVID-19 infection, or they were particularly vulnerable, i.e. People aged over 70. Now, the release or the waiving of certain restrictions on different services and the amount of investment is quite considerable. But of course, it doesn't mean to say that the infrastructure is there in order to spend the money in the most effective kind of ways. So, for instance, in the United States, you've got a very mixed model, including Medicare services provided by each of the states, and then you've got a raft of private services, telehealth services, which do reach out to quite a wide range of people. But if you haven't got health insurance and if you haven't got the connectivity, of course, then you're not going to be able to benefit from that. There is some experience of operating across very rural areas. Alaska, I will mention for starters. And then we can also look to Australia with great experience of rurality in Western Australia particularly, and where there are well-established telehealth services. In the UK, things are a little bit different. There is increasing experimentation and interest in telehealth, and within existing budgets, we can see health trusts encouraging GP practices and hospitals to do more of their consultations by telephone and also video consultations as well.
Did the COVID-19 outbreak put the well-established telehealth systems under pressure, or were they were they well prepared?
No one was prepared because really of the scale of the problem, or the scale of the impending problem. We have to make sure that the clinical services, hospital services, the health services, the community health services are geared up for any future pandemics that may occur. We haven't had a pandemic like this for a good number of years, but of course there is now the fear that even COVID-19 might mutate into something else. And so we need to be ready for this. So there will be not just lessons learned, but even some of the frameworks that are in place will continue. And this begs the question as to whether or not we will revert to more face-to-face meetings between patients and doctors after the COVID-19 crisis is over. And I think the answer is probably in part, yes, that will happen. But we will have a clear idea as to where and how telehealth services have an advantage. So I think we'll have what could we call it? A balanced portfolio of services that include telehealth, that includes face-to-face, in-person consultations, but where we'll be clearer as to the advantages and disadvantages of both.
So if we would like to prepare telehealth systems for future pandemics, is it just the sheer scale of the system, or do we also need new kind of technologies or new kind of qualities in a telehealth system?
I don't think there has to be huge new breakthroughs with regard to the technologies. We certainly want to have better communications networks, broadband and so forth, with the right kind of capacity to send information and images. I must mention something else as well, which is that a danger lurking at the side, and that's cybersecurity issues. I mentioned a little bit earlier the issue about personal data, and there's no doubt whatsoever that we must have to have systems and frameworks that are secure.
How far is telehealth just treatment and monitoring, or is telehealth also preventive or even predictive medicine?
Telehealth will become what we want it to become. So therefore, if we choose to permit telehealth services or some telehealth services to operate on a basis where they gather not just information on your lifestyles, but also information on your genetic profile, or we choose to give our genetic profile information to a particular service, then clearly you're right. We can expect more predictions to take place about your personal health and why and what you need to do in order to help manage that health. I doubt we'll get to the point that where a service will knock on your door or call you up, I would imagine, and say that you're liable to a heart attack in the next week or so. But certainly it may point to your lifestyle or some indicators about your physiology that could point to an extra likelihood of you having a heart attack, and clearly there might be some change to medication that takes place, or you might be taken into hospital or whatever that is necessary in the circumstances.
Is telehealth an issue of regional level, of national level, or should we go for a global telehealth system, perhaps as we have Google or YouTube, which are global platforms?
We may well find a lot of similarity between services in different countries throughout the world as things do go forward. But the situation at the moment is somewhat messy. We'll settle down, I guess, in the next 6 to 12 months. And the technologies, of course, become increasingly international. So a formula that's adopted in Australia may well find itself being used in Vietnam or wherever. So it's the approach needs to have, if you like, a global underpinning. The technologies, because lots of them are ubiquitous, will be adopted in different ways in different countries, but no doubt there'll be a global element to that. But that doesn't, of course, restrict or remove the potential for small companies operating in a particular region or a particular country.
What are the driving forces aside COVID-19 that would promote the dissemination of telehealth?
I think the driving horses come from both directions, both from the service providers who want to cut costs or see telehealth as a way of expanding their service without increasing costs, perhaps I should say. But a lot of it will come from patients themselves, because if they're not getting the service that they want from the services that they are familiar with, then which may be a publicly provided service, then they will go to the private sector and they will buy it from there. And the publicly provided services will wake up to this, I think, now fairly quickly. Clearly, the COVID-19 crisis has been a huge wake-up call anyway, but this brings telehealth right into the center of lots of people's thinking about the reform of health service provision.
Let's briefly have a look into the future and, if possible, beyond the current crisis. What does COVID-19 mean for telehealth and the uptake of digital health in general?
Well, I will join the chorus of voices who say that COVID-19 will change practice forever and that telehealth will be more firmly on the map. I wouldn't go as far as some people, though, because I do see some reversion, if you like, to the original service patterns, because that's what GPs, that's what doctors, that's what consultants are used to. But the great thing about this is that, as I mentioned earlier, we will get a better feel as to the role that telehealth could and should play within the range of health services. And of course, I think the bottom line is that it would meet with the choices and preferences of a very wide range of people.
What are other digital technologies that in the future might have a strong effect on telehealth? For example, Internet of Things, artificial intelligence. Do you expect strong impacts of such key enabling technologies on telehealth?
And you could add to your list there robots and robotics as well. Some of them are, there's a lot of hype around them. And I think, therefore, the contribution that they might make may be exaggerated, or they may be being developed in a way that doesn't take sufficient account of health and well-being issues. So, smart homes, for instance, certainly we all want to live in smarter homes, but a lot of the tendency is to think of high-tech homes which are modern and built according to particular standards that are probably only available to or affordable by the wealthy. But actually, let's look for smart solutions that work for all of us, however humble our home might be.
Smart homes, in many cases, the proposition is about convenience and a few new gadgets. Smart health and telehealth could be the proposition of 3 more years living at home independently for elderly people. Do you think this proposition will be made and achieved in a few years from now? Is this the real power of telehealth?
Not telehealth on its own, but certainly that proposition, I think, is realizable if we shift our attention to telehealth as being a tool for preventative health as well as being reactive to particular things that arise, conditions that arise. So if we can encourage people to adopt better lifestyles and so forth, yes, we will see increasing longevity. Smart homes and the tools within smart homes or in the Internet of Things may indeed help in the communications that people have, and therefore, if they help in the communication and people are encouraged to use those communications networks, then of course the foundation is there for them to learn more that will help them self-manage in relation to their conditions and adopt better lifestyles and live longer.
Thank you very much for this interesting interview. All the best. Stay healthy. Thank you.
Thank you.